everybody. I'm Michael Munson, and we're happy that you are here tonight with us to talk about the fun and, like Joanna just said, the riveting topic about insurance. Maybe you didn't just say that, but it's a riveting topic, and it's a very important topic for a lot of us. So we're glad that you're here, and let me just do a little bit of housekeeping, and then I think our style tonight is going to be a little bit of a conversation between me and Joanna, and then we'll have some time for questions. So right now, everybody is in a listen-only mode except for who you see on the screen, and right now we're the only ones that are sharing our video, but we can probably change that later if we would like to or need to. So if we could do a quick little Zoom walk around, if folks could find the raise hand button, could you raise your hand? So it's usually at the bottom of your screen. And oh, all right, y'all are quick. Way cool. Way cool. And then why don't we find the chat area, which I know a lot of you have already found. Why don't we do the question of what is the thing that you like best about health insurance, whether you have health insurance or not? Being about to afford care. I always love checking benefits. I worked in the emergency department. It's good when I don't have to think about it. Having them pay bills. At least the prescription medications I need are covered. Able to afford care. Mm-hmm.
Michael, Let's ask what they don't like, because that might help us.
Cool. Yes. Let's flip it around. So what don't you like about health insurance?
I've got a list.
So I'm not doing this in chat, but I know like some of my list is like prior authorizations for like half of my meds.
Yep. Oh, okay. The way the state handles it, yeah.
Yep.
We can talk about that for sure.
Yep, and someone else is saying, how some meds are covered. You can't have enough proof that you need to have a procedure done, and they still might not say that it's medically necessary, not knowing if it's covered at times, not liking the stress of having to determine what's covered, the stress of choosing one. Mm-hmm. Yep. Those are all things I think we're going to talk about tonight. Cool. I wanted to mention too, before we get rolling too far, that we are really grateful for the funding from Advancing a Healthier Wisconsin Endowment through the Medical College. And that has allowed us to formally partner with Frederick and the Medical College of Wisconsin's Inclusion Health Clinic, which Joanna is part of. So it's been a really wonderful relationship and fun to have the opportunity to work closer together than we had in the past. So, okay, those are the prep pieces. So why don't we start with some really simple conversations? We can start partially with what's in the chat, but maybe we can roll back just a little bit more and talk about if somebody's uninsured, how do they look for a new insurance plan that might be trans inclusive or cover trans related care?
So can I first introduce myself just so I have some street cred?
Excuse me, that was so horrible. I am sorry. Yes. Okay. Rewind this. Hey, everybody. Joanna Booker is on the phone with us and on the Zoom with us, and she's going to share who she is, so she has street cred. Thank you very much. Clearly, I think the world's pain is like causing us to not.
Mm-hmm. Yeah, I'm very open about the fact that my frontal cortex is jello, so I just assume everybody else is too. So I direct social services for the medical college and oversee all of that for Inclusion Clinic. But I, first and foremost, am a clinical social worker. So while I support our staff who do this work, I am also frontline providing care and have done that work for just over 15 years. So Inclusion Clinic wasn't around for 15 years, obviously, but doing that work in other capacities as we built our program. So that's kind of where that comes from. I know a lot, definitely don't know everything. So we'll take it from there, and I might learn something tonight too. So that's my hope.
So we can quiz you then about what you do know.
Sure. Yeah, I love that stuff. I give insurance talks to a lot of people, like a lot of people.
Right.
So hopefully I have some answers, but I'm always excited to learn new things too.
Okay. And you are going to call me out again if I do something stupid, like not say, hey, tell us who you are. So
we don't use the word stupid here.
Okay. Well, you call me out anyway. Okay. So can we start about like what happens if somebody doesn't have insurance and they're looking for a plan, whether it's through healthcare.gov or through state or wherever, but let's say it's not through their employer where they may not have a lot of choice. How do they figure out if a plan is going to include the trans-related care that they would like to have?
So I think the important place that we start is often figuring out kind of what road we're going down for insurance. And a lot of that is decided for us based on our income. So in Wisconsin, if you're eligible for Medicaid, I always tell people to consider that as eligibility is kind of at the $1,000 a month of income mark. It's technically higher than that, but not a lot. And it helps to kind of think of that firm round number so that you don't accidentally go over it. So it's like a little over that, and that's before taxes. So if somebody falls into that category, they know that they can access insurance through Medicaid. And Medicaid in Wisconsin has become increasingly inclusive in terms of ability to access care across the spectrum, but really specifically around trans health. So I think probably lots of us know about the lawsuit that was brought forward around supporting trans healthcare needs. And so doesn't mean that the fight's not over, doesn't mean that we still don't have to go through some paperwork and advocacy sometimes to get that healthcare, but we are in a better position now for someone who is on Medicaid. For anybody who makes more than roughly $1,000 before taxes every month, if they don't have an employer-sponsored plan or a parent under whom they can be covered through an employer-sponsored plan, the option is going to be private health insurance, and we can get that in one of two ways. We can move towards what everybody refers to as Obamacare, which is the health insurance marketplace, but there's some rules about when you can jump into that marketplace and when you can't. And that's a really good thing to be talking about now because we're getting close to the door opening when anybody can jump into that. And if that's not an option, and I'm happy to talk about what those rules are if people on here want to. This is a talk that I actually give that to like people who do this for a living, and it's a 2-hour talk. So I want to pick the things that are most valuable. If marketplace is not an option for a couple of reasons, then we're talking about trying to seek out a plan through a private insurance broker. And either way, when you're looking at a private insurance plan, before you buy, you get access to what feels like an overwhelming list of covered services. And that's what we want to ask for and really go through with a comb to pick at each line to understand what is covered. And I would say there are lots and lots of people at our clinic, at Forge, at other community centers that will support people in understanding those things because that's really overwhelming. Like insurance is kind of like learning Latin, and Latin's kind of a dead language. So you want to find the people who speak it to go through that with you.
That's cool. And I think a lot of people hear about like healthcare navigators. So would that be like who could help with understanding or getting access or not?
So healthcare navigators can help you get access. Healthcare navigators are no longer funded by the federal government, and so 90% of them have been eliminated in Wisconsin. So it's harder and harder to find a healthcare navigator. And all that means is for a healthcare navigator is somebody who is tasked with a job of only helping people enroll in insurance. That's it. And a couple years back, that was a funded position by the government. So they don't always have, more times than not, I would say, any concept of the kind of health care that someone who is trans might need. So yes, they could help with access, but if I'm speaking honestly, I don't know that I would bring forward my specific healthcare needs to someone like that and expect them to be fluent or honestly necessarily competent enough to piece that stuff out.
Exactly. So if folks are living in Wisconsin, they can certainly come and talk to Forge folks. Shelley Gregory is the person who knows more than anybody else on our staff about insurance.
She's awesome.
The inclusion clinic, and somebody there could possibly help with navigating those processes.
And we do that with folks all the time. And honestly, every hospital has financial navigators who are supposed to be able to help you piece through insurance options as well. So while they may not be fluent in trans healthcare needs, they could, if you were somewhere where you couldn't get access to someone like Shelley or someone at the inclusion clinic or Forge, that would be a place to start, because they can at least assess what resources you do have. And then once you have kind of a handle on that, you could, reach out to somebody to ask you to go through like the details of the plan you're considering.
Perfect. So
we had a question about Medicaid, which was, do events like getting a one-time inheritance count for Medicaid purposes?
No.
Okay.
I'm happy to go more into depth in that, but no. It counts as, so first of all, they may not know you get it. You don't have to produce bank statements for a Medicaid application. You do have to produce, if you're employed, you have to produce proof of income, and they look at that monthly income. In the most, I don't even want to say worst case scenario, like significant case scenario, you could potentially get that reported, and they would report it as a one-time income moment for that month, and then you wouldn't have benefits for that month, and then it would go back to your standard income after that event.
That's cool. So let's say you have insurance, whether it's through Medicaid, Badger Care, private insurance, wherever it's from, and you want to find out if hormones are covered or surgery is covered or some form of trans-focused or trans-related care is covered. Is it safe to call? Does it out you in a way that they're going to deny other care? How do you find out? Like literally, how do you find out if things are covered?
So I like to think about dealing with insurance a little bit like going to war. And the goal of that is not to run into it alone, right? So I would encourage you, if you were completely alone, to start by just going to the insurance's website and getting a list of covered services. That's the law, that it has to be posted and available. It doesn't even have to be posted and available to you as a member, but posted and available to anybody. So I would start with that, and it's going to be thick. And I would start going through it to identify areas that are very clearly going to be covered. And then there's going to be areas where like, I'm not really sure if that's covered. So I would have that list before I ever made a phone call. And then honestly, if it were me, I would find my advocate either at my provider's office or at my community system, because lots of us have gone through different, experiences. And so even if you're not connected to Forge or somebody else, a lot of times there's, somebody who's gone through things. And I would strategically list out medical care that is needed. And I think if I had a good relationship with my provider, I might actually work with them to have them do some prior authorization work. So it's not coming from me, because it gets totally detached from you when a physician's office is trying to get information about a covered service. So going back to it, right, like really leaning into the fact that it can be a really isolating experience to try and navigate insurance anyway, and taking that out and trying to connect with people, even if it's just on the basic, like, I don't want to be your friend, I need your help, and here are the resources that I'm looking for. And in a total worst case scenario where like you have none of that and you really want to have a conversation with someone, most insurances actually have a healthcare advocate that is connected to them. And so I would call and seek the healthcare advocate and ask to go through, like, I'm just trying to understand covered services. Is a hysterectomy covered? Are hormones covered? And just like, not as it relates to me, I'm just going through this and trying to understand what my insurance is covering for anybody.
Cool. And it should be in writing, right? People should be able to find that in writing.
Yep, it should be in writing. once you make that phone call, they won't give you that high level detail without you identifying yourself. So that's why I would take the time to do all of the work you can ahead of time, because some of those, inevitably, some of those questions will be answered for you.
Right. That's cool. That's really cool. So if we look at other logistical or practical considerations, so let's say somebody has changed their name or gender and they would like to do so on their health insurance. Can they do that? What generally is required for them to do that?
Yep. So this is a really, it's a really big deal for lots of reasons, but it's a really important thing to know, to do right from a billing standpoint. I so often have folks that I'm taking care of who legally change their name, and so they want to change it in their medical chart. And I'm always like, that's super exciting, and I want to change it in your medical chart, but we don't want to do that until your insurance card matches that. Because if I change my name, but you still try and bill it through my dead name, they're going to reject it, like over and over. They're going to think it's a different person. Even if all the gender markers still match, they're going to reject it. So the things that insurances will require is that you have all documentation changed. So you'll have to have proof of the legal name change, birth certificate change, and usually social security card with a name change on it. And they'll have to submit that to them. And then once that's done, everyone I've done that with, as long as we've come with all the right documents, it's pretty quick. And then they'll reissue you an insurance card with the correct name. And then you'll give that to the doctor's office so that everything aligns. And then you change your name with your medical record.
That is really fascinating, because I know so many people that have not had to produce birth certificate, social security information, just the legal thing. So it's really interesting for you, for me to hear that, because I wonder how universally true that is. And I certainly trust your experience, but that's not what I've heard from folks. So, and
I would agree. I think that you could call United Healthcare and get Susie Q, who says, I need all of these things. And you could call United Healthcare and get Susie K, who would be like, send it on over, we're good.
Right.
So my strategy is to bring as much as I can to be like, this isn't even up for discussion, Susie Q, like change it.
Right.
But I agree. I know lots of people who have not had that experience and have gotten it through, and then it's like, great, let's go.
Yeah. And then once it's done, it's done. So,
right. But you never have to go back.
Yeah, exactly. Yeah. And I'm all for it. If you have all the stuff done, go ahead and do it. But, sometimes those are barriers too, that people can't get their birth certificate changed, or if they were born in a different state and all of those other things. But yeah, so if you have it all, send it all in. If you don't, then you can try for it and see what happens.
I would agree. If you don't, that doesn't mean you shouldn't try. If you've got the legal document showing that your name is changed, try for sure.
Cool. Really cool. So other kind of practical or logistical things. So let's say somebody has their insurance through their employer, and if they have medical care that relates to their transness, the question is, will my employer find out? So let's say they come in as female, they were assigned male at birth, they're living as female, they've got hired as female, but they need an orchiectomy, or pick whatever it is. Will their employer find out?
So there's so many gray areas in insurance. There's no yes or no answer to that. If the person that you're working for, the employer you're working for, is self-insured, which means that they've created their own insurance system. So for instance, at the medical college is self-insured. And while this is kind of a large example, you could end up being insured through a much smaller organization where things are self-insured. And while it is supposed to be private and supposed to be protected, I know a lot of people for whom that was not true. A lot of people. And that's a really painful thing to go through. If you're at a larger employer, they will farm out their benefits. And what that means is you might work for me, but I have I pay Michael to manage all of my healthcare stuff. And Michael and I don't talk in this scenario. Like, Michael lives in Omaha and I live in Pennsylvania, and that's Michael's job. And I'm like, great. And I send everything off. I never even see it. So for places like that, and that would be a place like Target or Walmart, or, a larger place, it's very likely that would never make it to me as the employer. But I think that the anxiety around the possibility is real and valid, and I can't eliminate it.
And I think that, those of us who are trans or know or love somebody that's trans know that, your history is always something that might be disclosed either intentionally or not. And that's one of those places where we can't always ensure that it will not somehow slip through. But it's a good question to think about. And, I think for people that are really concerned, they may want to buy external health care and not go through their place of employment if they're that worried about that.
But that's a really good pivot point to just go back to those kind of paths that we were talking about. If I turn down employer-sponsored insurance, I can't go to the marketplace to buy a plan. I have to go into the private marketplace where I pick my own plan and I buy it from a broker, and those do tend to be more expensive plans. It doesn't mean don't do it. It means plan if that's the route that you have to go.
That makes a lot of sense. So let's talk about denial of care or discrimination in care. So let me read you a couple of questions. These are kind of like from a first person perspective. So if the person says, every time my healthcare provider orders labs to check my hormone levels, my insurance company denies it. I'm listed as my affirmed gender with my insurance company, so they don't understand the need to check hormone levels. What can I do?
Yep, this happens a lot. So you can always appeal, and you will appeal. I think what is so exhausting about that is that one should not have to appeal every single healthcare decision that is being made. We help folks. I help folks appeal all of the time. I've never, and Michael, I'd be curious if you know, I've never experienced where we've been able to implement something in the insurance company system where it just never happens again. I've successfully helped call repeatedly and make those changes, and then we get a good run where that's not denied, and then you get somebody who's shifted or the computer system shifted, and then we're back down here and we got to do it again. So I think the message I would say is never take that denial for what it is, because it's garbage and it's changeable. But also arm yourself with a form appeal letter, which I keep. I just keep them. And then I just change the things I need to change, the dates and, the labs and the person, and off they go. And Michael, I'd be curious if you've ever experienced a time where it really just worked permanently, because if you've had that success, I'd like to know how, so I can have
I don't
that
think
success.
it has either for people, but I do think, like you said, sometimes you go on a roll, if it's a person with the same insurance company and, the insurance company approves it year after year after year. And then, maybe every once in a while it's like, oops, we're not going to do it. But, I think that this is where the insurance companies are doing their job, and our physicians and our, healthcare providers and our advocates are doing their job. So it's kind of sometimes they don't mesh together, because the insurance company's jobs really are kind of to deny things. That's their job. They want to save their money. So they're looking at these things. Does this line up? Kind of like you were saying with name and stuff. If somebody's name is different than what's on their insurance card, it's going to get denied. So same with things like, hey, why is this lab test needed? So we've not had the same. We've had the same experience with.
Yeah, we've even tried to work with understanding if how it's coded, which is how it gets entered in the language that insurance gets. Insurance doesn't get your medical notes specifically. They get these little codes that say why it was diagnosed or why it was ordered, I'm sorry. And so we've tried to play around with those to see if there's success there. I've not personally been aware of anything that's completely solved that, but we also have some wizard physicians who figure out those tricks sometimes. So making sure that your physician knows that that's an issue is really important too, because they can sometimes be supportive around how they do put in codes or thinking creatively about medical records so that that can be alleviated. It doesn't always work, but it can.
Yeah, and this makes me think, Annie was talking the other day when we were talking about masculinizing hormones, that, her general schedule is to run labs every 2 to 3 months for the first year and then switch to a lower frequency. And I think a lot of insurance companies would be, well, it's fine to check it once a year, but why do you need it every 3 months? And so sometimes those are the cases where we need to step in and say, well, this is why, or we're going to try to code this differently. So yeah, those can be tough. Next question I'd like to ask about is, can my insurance refuse to cover gender-affirming care because of the HHS rule, so 1557?
Oh, man, these are good questions.
Hopefully that's not too hard of a question, because I kind of have the answer to it, but
Okay, I want you to answer that for me then, and then I'm going to talk a little bit about some outliers, I think, because I think that's in my head, like, there's just no black and white to insurance, especially around trans healthcare. And so, yeah, go ahead, and then we'll riff here.
So hopefully what I'll say is accurate. So HHS is the Health and Human Services Department. So it's, one of the federal kind of branches. And 1557, I believe, is like a non-discrimination kind of guidance underneath that. So in that, which was developed under the prior administration, it said that basically kind of what some of the Supreme Court rulings and other rulings have been, that when sex is talked about in there, it includes this really broad category of things like gender identity, gender expression, and that includes trans-related healthcare. So basically, the answer of can I be discriminated against based on HHS? The answer should be no. You can't be discriminated against based on Section 1557. But we all know that just because something you're not supposed to be discriminated against doesn't mean that you won't be. That's my answer.
Yes, I agree with all of those words. I think the caveat comes in for folks when they are employed by someone who actively chooses not to have a plan that is fully covering and supporting. And that is not illegal. It should be, in my opinion. But it is not illegal for the employer to say, we've developed this insurance plan and we have actively chosen to exclude trans healthcare needs. There are many, many lawsuits, and there are some really extraordinary legal advocates around the country who work with people to fight those fights. But it is right now not black and white against the law to discriminate as an individual insurance carrier if that's how the policy is written.
And this brings up, I think, something that I think is oftentimes confusing, and it's confusing for me. So maybe you can clarify it. So the HHS and the 1557 came out of the Affordable Care Act, correct?
Yep. Yes.
And that not every insurance policy has to be like under the Affordable Care Act, right? So
Correct.
Like you were mentioning, it could be a separate policy that wasn't like through the marketplace or not governed by that.
Correct.
So that's the loophole.
Yep. Yep.
Okay. So the next question is really about religious exemptions. So, if somebody worked for an agency, like kind of like what you just mentioned, they could be insured under a policy that wasn't affected by 1557.
Yes.
Okay.
Yep. And there are things that have come forward that you may or may not have seen in the news that are discriminatory in nature, maybe not specifically around trans healthcare, but examples would be that the Affordable Care Act requires that something like birth control be made available. But there was a very large lawsuit that went up the chain to the Supreme Court that said, nope, you can't force the Catholic Church to provide that service. So that's a really extreme example of how that's being played out. But we are seeing that in other areas of healthcare, including trans healthcare.
Okay. So we know that sometimes, trans folks have a hard time finding job and finding work, and everybody right now in COVID land is having a hard time if they need to find a new job, that especially if it has insurance. So this is again one of those things, if an employer has some restrictions or exclusions, that person might need to either accept that or try to find another job or pay privately. And then it gets into that loop of if their employer offers insurance, they won't qualify for healthcare.gov insurance plans, right? Yeah.
I always tell people when they're on the fence about taking a job, which if you need a job, you're not standing on a fence. But, if you have the opportunity to be considering a job, it is appropriate to ask human resources for their full coverage. They're supposed to provide that, obviously, but that's part of the package you're being offered. And so if somebody is extending a job offer to you and you're in the position to potentially say no, that's a really good time to say, tell me about your benefits. Can you please share with me all the covered services? And that's not because I have, health concerns that maybe are expensive, or because I have, a pre-existing condition that's expensive. That's part of what you're offering me as an employer, and I want to know what that looks like.
Yeah, that's excellent. So a kind of related question to HHS and 1557 is around the recent Bostock decision, so the Supreme Court decision. Does that impact at all health insurance?
I honestly don't know. This would be such a good Shelley question.
The answer would be no, because I can answer that one with certainty because that was only about employment.
Thank you.
So, I mean, that's a no. All right, so we'll move on.
But we have a good question in the chat that I want to respond to. So the question being, if I have a health insurance where the employer's insurance is not covering all of my healthcare needs, could I get a secondary plan? You definitely can. It's the matter of finding a plan. It would be considered supplemental insurance. So what happens when you have that is they bill your primary insurance and then they bill your secondary insurance for anything your primary insurance didn't cover. One of the barriers to that is to get a plan that is fully comprehensive, you may be paying a fair amount for that supplemental plan too. Doesn't mean you shouldn't do it. It just kind of is like when you're building your budget and thinking about what you can and can't cover. I work with a lot of folks who are like, it's cheaper for me to pay for my hormones out of pocket than to deal with that. But if you've got a big surgery coming up or something else, that is a really smart thing to consider.
And that's a really good question. I'd never even thought about that in terms of, I think about it in terms of like Medicare and getting a secondary or a supplemental. So you can do that if you have insurance through anywhere.
Yeah, anywhere. If you think about it, it happens for parents. There might be an insurance that two parents have two separate insurances and they could put their children on both plans. You can do the exact same thing as an individual. You have to list, when you register with your medical provider, you have to list your primary insurance and then your secondary insurance. And when you're buying the secondary insurance, you have to disclose that you have a coverage that is senior. So you don't get to pick and choose. When you're buying that secondary insurance, it comes in always as secondary because you're buying a plan saying this is only going to get billed once this gets billed. So it's things to keep in mind about how things are layered, but absolutely any of us can do that. And right, exactly like if you have Medicare and getting that supplemental plan, it's in the same way.
That's a really brilliant way to kind of, I don't want to say get around an exclusion, but if you really like your job and your job has trans exclusionary policies, stay with the job that you like and see if you can afford to add in another level of insurance. That's a really cool idea.
Yep. I would say you want to find a broker that knows those sorts of rules and that you feel comfortable being transparent with about why you're getting the secondary insurance. You don't want to go to someone where you're just like, hey, I just need a second insurance. I want to go to somebody who's like, hey, I'm planning top surgery in the next 6 months. And that's why I'm buying this plan, because my first insurance covers ABC, but doesn't cover this really important healthcare need, so that they can help match you with a plan that can meet that need. Otherwise, they're going to sell you something that could be just as bad as your first one, and then you're stuck.
And you're broke.
Right. You're broke and you can't get what you need.
Yeah. Okay. This brings up, I think, another area that I really was hoping that you would talk about, which is if somebody has an ACA plan, an affordable care plan, or one through their insurance or through their employer, where do pre-existing conditions come in? And if gender dysphoria is a medical diagnosis, which we can argue whether that's good or bad, is that a pre-existing condition? Can that be held against somebody?
Right now, technically, no. The current administration has worked really hard to make changes that right now excludes discrimination against pre-existing conditions, but it's not gone through all of the legal fights that have been put up against it. So right now, you cannot be discriminated against or denied care for a pre-existing condition.
Under any insurance plan?
Well, if it's under a plan that is ACA compliant, which most plans are supposed to be, but yes, you're right. If I work for that crappy employer who doesn't cover any trans healthcare needs because they developed this plan and nobody sued them for it yet, technically, yes, they don't have to be compliant.
So that makes me wonder, are plans that are not available through healthcare.gov, so not through the marketplace, are most plans, what was the word that you just used, compliant?
Yeah, they're supposed to be. So the Affordable Care Act law was wide-reaching, and it essentially re-informed insurance around all insurance carriers, whether you bought into the ACA as an insurance carrier or not. There are tools and guides that, like, that's part of why people were so upset about it, because they felt like, right, whatever, like it was being restructured against their will. But that's essentially what an ACA did. So like you could go to an employer and get your insurance. The employer is still held to ACA standards unless they're attempting to opt themselves out. Like, for example, the lawsuit that went up to the Supreme Court who didn't want to pay for birth control, right? Like they took that seriously and they took it all the way up the chain because they were violating the Affordable Care Act. So everybody is technically held to that standard. And so technically, if I've got an employer who's written a policy that writes out the care that I need as a trans person, I could technically sue them because they're out of compliance with the Affordable Care Act. Now, who has the capacity to do that is not many, but they are all held to the same standard. The issue is how hard we fight to make sure that they're held to that. And that's what some of the legal advocates around the country do, is they support major lawsuits against organizations, cities, governments, whatever, that are creating insurance plans that are not compliant with the Affordable Care Act.
And like you just said, a lot of us don't have the spoons or the energy to, like, you know, bring a lawsuit or even talk to the ACLU or whoever else, right? It's just, it's unrealistic.
But just the backstory of, yes, all insurances are supposed to be compliant.
Okay. And I think that's just really confusing for a lot of people, me included, that, you know, what's supposed to happen, and is it only the ACA plans, or are they all, or whatever? So that's good to know. Can an insurance company deny care for specific body parts?
Sure. The immediate answer is yeah. This is like the most non-feel-good thing to be doing on a Tuesday night, is saying all the awful things that insurance companies manage to get away with. Yes, they can. Again, for all the reasons we've been talking about for the last half hour, with the right tools and advocacy, you can get them to scale that back and get in line. But unless they've had someone fight that fight with them, yes. And then if that is something that happens, then we go down that appeal path. Nothing is ever, the door is closed, right? Like, so there's a running joke around me, because no, when it comes to like systems, just is not a word that I believe in. Like, if the insurance company says no and closes the front door, I'm always like, that's cool. I'll just walk around to the back and find the bathroom door and kick it open and climb in the window, and, you know. So yes, they can, but never take no for an answer when it comes to denials like that.
And have an advocate in your corner who can help fight those battles, because it's hard to do that if you're...
Oh, it's impossible to do that alone. I am a pit bull, and I wouldn't want to do that alone.
Right. So we could talk about some of those examples, but I'm aware of our time. So let's, you mentioned before prior authorizations. I think a lot of us have heard those things. Some of the initial question was around, like, will my meds be covered, or do I have to fight for them? Can you explain what a prior authorization is?
Yep. So prior authorizations exist for more health care or health appointments, procedures, medications than you can even fathom, like billions of them. So what that means is that I have to get the insurance's permission before they agree to cover it. So if there isn't something that is required, I can go in and I can go to my doctor and they can prescribe the things that I need, and I can get it sent to the pharmacy and I go pick it up and it gets lumped into all the other insurance things that are covered, and off I go. But for so many things, often expensive things, they require the insurance to give me permission to do that. And this is not exclusive to TransCare. And I say that because it's a really assaulting feeling to not be able to get the access to care. And it's really hard not to feel personally like, what the heck? And truly, this is like spans from diabetes to, I mean, everything. I can't even think of something else arcane. So what it means is that a form, now a digital form, gets filled out and gets sent off to the insurance, and Susie Q reads it and then says, yep, covered, and off it comes back. These can take up to 30 days, which seems pretty ridiculous because what is Susie Q doing but saying yes and no to things? And what Susie Q is doing is literally plugging it into an algorithm and saying yes or no based on that. So a prior authorization is really just the insurance saying, yep, we will pay for that when you go get it. If you try and do something that requires a prior authorization without doing that, it will get denied. And it doesn't mean that that's denied forever. It means you didn't follow the rules that the insurance requires before they'll approve the cost of something. So that goes for a lot of medications, often hormones, but not universally, surgeries of any type, honestly, whether it's trans-affirming or not. Like if I need to go get knee surgery tomorrow, my insurance makes me do it. So it's a procedure to try and control, honestly, how much they're spending. But it's not actually something you should have to do. And that will happen often where folks will try and call ahead themselves and be like, I have to get prior authorization. Let your medical people do that. Even if you've never even been to a clinic, they will do the prior auth for you. If you call and schedule and say, I think I might need a prior authorization to see this provider, most good medical places will say, oh, okay, we got it. And it'll run through a whole office. There's a whole financial office attached to most big places that provide medical care, and they'll run it and off you go.
Perfect. And I think this, one of the things I made notes about was like insurance companies generally have formularies. So lists of drugs that they will cover or lists of drugs that you need to have a prior authorization for. So like when we look at testosterone, a lot of times insurance companies seem to want to cover injection, but they don't want to cover androgel.
Yes.
Androgel used to not be generic, and now it is, and it's a lot cheaper. But that used to be a common fight that people used to have.
Very common.
Their provider says androgel is better for your health and your body, but the insurance company would say, no, you need to do injection. So there's a little bit of friction.
Yep. And there is some back and forth. Like, so what goes on behind the scenes. Let your providers do it. But what happens is the provider puts in the prior auth and we wait and we twiddle our thumbs. And then the insurance company either comes back and says, yes, do what you want. Or, well, just as you were saying, we don't really like that medication. We would say we'll cover injectables instead of topical. And then it comes down to the provider saying, no, I can't do injectables for reasons ABC, which is why you want your doctor to be in charge of doing all this, because this is not something you should be ever having to manage. And then they go back and forth and argue, and usually the insurance will be like, fine, right? Because the physician will be like, did you go to medical school, Susie Q? No? Okay, then stop reading your algorithm and say yes. Or they will be like, no, you have not proven medically that this is a preferred care. And then sometimes the physician will come back and say, we fought and I don't have a justification. We got to try this other route. And they'll talk about what that means for you and your experience.
And I know sometimes people, have to say, oh, I have to try the injection first. If we take the testosterone example and, I try it and, oh my God, I had really bad headaches. And then there can be some documentation trail that says this patient had side effects and therefore they can't take this form. So then we have to do it. So yeah, there are a lot of games that people have to play in order to get the care that their doctor or medical care provider has recommended. So what a mess, right? Let's talk about gender-affirming procedures like surgery or other things. Do you know if there are commonly procedures that are often not considered medically necessary that people are wanting to get covered and generally don't? That was negative too. We're still going down the negative route, aren't we?
Man, I'm getting really depressed. So the reason I'm hesitating is a lot of it depends on a couple things. The insurance carrier, but also the provider you're seeing and having that history of need. So that's really important for justifying to insurance when a surgical procedure is needed. And I think when I see surgeries denied, they are often because it doesn't come with the medical history of that prior auth, right? That's part of what happens in a prior auth is we demonstrate, I've taken care of this person for this long. These are the things that I know I need to do. Here's proof of why I know I need to do those things. That doesn't directly answer your question, but I guess I'm avoiding directly answering these surgeries don't happen, because they can happen. We just have to do them the right way. We have to have that history. We have to know our insurance barriers ahead of time. So if you haven't picked up on it, right? I like to plan everything's going to go wrong, because then if it does, I'm ready. And when it doesn't, it's smooth sailing, right? So having that history, knowing your insurance barriers, coming prepared with the PA, prior auth, you'll hear that a lot. People say PA, that's what they're talking about, is a prior auth. And then being prepared, we do often see things that are postponed. I mean, even hysterectomies where we'll schedule it and then we're doing that prior auth and then it didn't go through in time. So then we've got to push it back a month. So a good surgeon will also be really candid with you about, these things might have to be done and we might have to reschedule. And that doesn't mean if I call you and say I have to reschedule, it doesn't mean it's not going to happen. It means we haven't gotten through all the hoops. We want to get you scheduled. We're going to start all the hoops. And if we don't get through all of them, we're just going to push it back a little bit. That can be really emotionally taxing, right? Because you're focused on that surgery. You're getting emotionally and physically ready for it. And then to have that yanked is really hard. But a good surgeon is going to help you prepare it's a chance. And so don't panic if that happens. That was a roundabout answer, but hopefully
Oh, that's really good. And obviously COVID makes it more challenging too, not for that reason, but it's just there's delays a lot of times, and that's another reason for delay. The areas that I was thinking about were I think a lot of times insurance companies will cover vaginoplasty, but they won't cover breast augmentation. Or they'll cover, breast augmentation, but they won't cover facial feminization surgery, or they'll cover, chest surgery, top surgery for trans guys, but they won't cover liposuction to get rid of the dog ears. So those are some of the things that I think people get frustrated about.
And I would say again, right, those initial denials, we appeal those. And having that history and being able to demonstrate why they are medically necessary, because they are medically necessary, is really important. And lots of times those are won, not every time. And I certainly work with people who are forget it, I'm paying out of pocket, but that's not a luxury many people have.
Yeah, that makes sense. I'm just looking at my list of questions that I think we should cover, and I'm aware of our time, and I'm curious, maybe we should open things up a little bit for questions from the folks that are attending, and then we were going to end on a positive note. So we need to think about
let's find something joyous about insurance, Michael.
Right. Right. So we can think about that. So if folks, and I didn't mean to say before, let's not ask questions now, because Laurie was totally right on target for interjecting that. Can folks share the questions that you all have? If you have them. Otherwise, I'm going to go back to my magic list that Joanna hasn't seen and surprise her with another hard question. So a question is, will insurance cover COVID-19 vaccine should one become available?
That's a super good question. The answer is we don't know, in large part because it's happening too fast and we just don't know. My gut is yes, the same way insurance covers flu shots because it will be considered a vital healthcare service. But because it's not even been generated yet, it's not anything that's being considered. But that's a really good question, really good, important question. Same along the path of, will insurance cover a COVID test, which we get those questions a lot right now. Most insurances are, but there are, just as a side note, there are mechanisms to get those tests at no cost as well. So I don't want to diverge down that, but it doesn't directly answer your question, but my gut says yes.
Yeah, and I would hope so too, that it would be covered, because that's, it would help our whole world if that would be covered. while we're waiting for anybody else to ask a question, I know that so many healthcare companies, not healthcare companies, providers' offices are asking for people's chosen names, people's names of use, people's pronouns, which is fantastic. But I think a lot of people have concerns that that information might get told to their insurance company and then cause potential problems. Can you talk about what that might, what that might mean if the healthcare provider has that information, but where does it go? Does it get released with the medical records or?
Yeah, that's a really, really good question. So those things are largely, so let's start with the things around pronouns and preferred name. I really dislike that qualifier of preferred, but those things sit in a really generalized / personalized part of your medical record. And they aren't the sort of thing that gets released if I request my medical record. So it's a spot in your medical record, for instance, that says, my name is Joanna, but I prefer to go by Joe. But it still says my full name. And then to the people who take care of me, it says just under that line, it says Joe or AKA Joe in this case. That wouldn't get released when I go off with my medical records. Same with the pronouns. It sits in this kind of surface area of the medical chart. The other things that are being asked in places providing comprehensive trans care are deeper in the chart, right? We ask and store questions about previous surgeries, gender-affirming surgeries, what organs you have, what organs you don't have. That does sit deeper in the chart, but when somebody requests their medical records, they essentially what happens is on a CD now, it used to be on paper, they literally compile the notes. And so they're called narratives in the healthcare system, but it's kind of like your medical story. And it describes the visit, it describes kind of vitals that they took, things like that. And the deep content around what I'm describing of what is collected about people doesn't sit in those charts that are released. They sit somewhere important in the full medical chart, but that's not what's received when someone requests medical records. Now, they may receive it if it's part of the physician's narrative. So if the physician is indicating certain things around previous surgical procedures or a health history, and this is where having a not affirming provider is really crummy because you get those medical records and you're like, what the, like, right? The narrative is so horrible for when people are not affirming. Those are the pieces that do go out. But that level of detail that you're describing, Michael, sits somewhere that doesn't come when your compressed medical record gets shared with you or with a health insurer or, with somebody else that you're releasing it to.
I want to ask a follow-up question, which is, so this might be in the weeds, but I think it's a really big concern for folks about what's going to get released. So I heard what you just said, but let's say that I am a 60-year-old trans woman, but my insurance says male and it says a male name. And my provider is really cool, really good with me, and writes medical notes that include she has had blah, 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 blah. So my insurance company reads this and goes, right, because that's part of the narrative. So would a provider need to kind of reverse their genderedness? Okay.
Yeah, if you're anticipating your insurance reading that high level note, which happens in an appeal, honestly. So like if we're appealing a surgical procedure, that's when they're really reading those notes. It's not day-to-day stuff that the insurance company ever looks at. It's when we get into the weeds on advocacy, honestly. And to counter that, if I have affirming notes and I am asking my insurance company to read those notes during an appeal, being appropriately gendered is going to be really important because it shows the history of my identity. Right? So like, they're going to be like, why the heck do you need a hysterectomy if you're being referred to as she throughout it and there's no, according to insurance, medical reason, right? But if I've got years of records that do affirm me as male, that, when you get into an appeal, there is a human reading that. That's not an algorithm. And so there is some human subjective teasing out of, so you can argue both ways. Absolutely.
Right. Totally. I totally get that. I think that's just one of those concerns, somebody's having knee surgery and that gets denied and then appealed. Would you want to have your insurance company seeing a different pronoun? So not trans-related care, but like the other care that people are getting.
Yep. All the other stuff. Agreed.
And it's hard. There's no one way that's going to be best for every situation. So Joanna, have you thought about the positive to end on?
Yeah, this was a little bit potentially depressing, but I think, every question that we had, I just kept thinking back to all of the healthcare advocates and healthcare providers that I have known in my 15-year career. And I'm not talking about exclusively here at Inclusion Health at all, right? Because we've only been open a couple of years. So I think having those affirming providers is so invaluable, because it really will support the fact that you're not in this process alone. And if you're not with an affirming provider, you really are. And so I have so much gratitude for the fact that we do have a community of providers in our state, in our adjoining states, who know the systems and who are really just supportive and can help us walk those roads. So even if you don't have direct access to an advocate, if you have a strong provider who gets it and who has done this work before, that can be really life-changing. And they exist, which, thank God, right?
That's a good answer. So I've been thinking about it too. So I think my positive is that we're living in a world, even though it's really hard world right now and a conservative world right now, that more and more companies really want to attract trans people to work for them, want to be like good on diversity and inclusion. And so part of their selling packages is to say, hey, we have affirming healthcare. We have, benefits that are going to support diverse communities, including trans folks. So I think that, people want to get the HRC, equality index scores.
Yeah.
More and more bigger companies especially are like, hey, we are going to go for this because we want to get that score, because we want to be a cool place to work for X, Y, and Z populations. So I think that sometimes is helpful to know that more and more companies care and are aware of trans health and trans healthcare and trans people, and they are welcoming of folks to come in the door. So that's my positive takeaway, and sometimes it's hard to come up with those positive takeaways. Let's wrap up for today, because I know that we're already after 7 o'clock. Joanna, thank you as always for being smart and cheerful on our exciting subject. And it really is an exciting subject, because most of us either have health insurance or really want to have health insurance. And these are the questions that people, often are asking folks. So I really appreciate your candid answers to questions, even if we don't have miracle answers. Yeah. And so Joanna, thank you for the good work, like always. And thanks everybody for spending your evening with us. And hopefully we'll see y'all on Thursday.
Thanks, everyone.
Thanks, interpreters. Thanks, captioner.